Thank you very much, Mr. Chairman. And first, I want to say right out of the gate that I think it is very doable to produce a bipartisan product here. We did that with respect to chronic care. We did that with respect to 10 years for CHIP. We did it, by the way, in the rural area as related to medical extenders, where we were talking about literally life and death matters like ambulances. So I want to make sure that we understand that on this side, we think it is very doable to come up with a bipartisan product. Each year I hold open to all town meetings in every rural Oregon county, and there I meet with many leaders from the healthcare field. And they tell me there are a few potential healthcare calamities that have them afraid for what is coming down the pike. First, many in rural communities feel that there is a wrecking ball headed their way because the Trump administration and half of Congress have spent the last 15 months trying to pull out all the stops to make enormous cuts to Medicaid. The president's budget, which of course is a public document, indicates that another assault could be coming. The fact is, Medicaid is a lifeline for rural hospitals and patients. And those who have been on the front lines will tell you, those who've been out there for decades, that if you want to turn rural America into a sacrifice zone where hospitals shut down and people can't get the health care they need, the fastest way to do it is by slashing Medicaid. Second, people in rural areas today feel that their local hospitals are already teetering on the brink of closing their doors. And if the local hospital goes under, that means no more emergency departments available in a crisis. Now, this isn't a far-off theoretical problem. Decades ago, back when getting routine health care more often meant spending multiple nights in a hospital inpatient bed, rural hospitals were much more secure. They could afford then to maintain the emergency department. But that service may be on the ropes now because rural hospitals are under such huge financial pressures. Offering a variety of inpatient services and keeping that emergency room open is extraordinarily expensive. And at the same time, more and more Americans are turning to outpatient settings for chronic care, rehab, and routine surgeries. Since 2010, 83 rural hospitals have closed their doors, and hundreds more are in dire straits. In fact, rural services have been closed since 2010, 83 rural hospitals. Bottom line, when you live in a big city like Portland, Chicago, or Los Angeles, you take it for granted there's always going to be an emergency department nearby. But rural Americans who fear their hospital will be the next to close are left wondering what's going to happen if their son or daughter breaks a leg in a high school basketball game. I heard exactly that kind of concern just a couple of weeks ago in rural Oregon. Where would the family go if an older loved one suffered a stroke? Would they get to a hospital in time if dad suffers a heart attack? Keeping these hospital emergency departments open is a key challenge when it comes to rural health care. In my view, it's step one when you're working to prevent rural America from turning into that sacrifice zone where people can't get the care they need. And I'll just close by this point. I've already indicated I think we can produce a bipartisan product here. I mean, a country as wealthy as ours looks like we spent about $3.5 trillion last year on health care. For that amount of money, you could practically send every family of four in America a check for $40,000 and say, here, get health care. It ought to be possible to guarantee that rural Americans are not on the outside looking in. Thank you, Mr. Chairman. Looking forward to working with our colleagues and getting that bipartisan product.
Well, thank you.